In today's health headlines, suicide in young girls is on the rise. Is instant access to medical records more harmful than helpful? And what to know about a new blood test for colon cancer? Joining me now is Dr. Arjun Venkatesh, Chair of Emergency Medicine for Yale School of Medicine and Yale Medicine. Welcome back, Doctor. Great to see you.
Hi, thanks for having me.
Of course, let's start with that study that found that suicide rates in girls aged 8 to 12 have increased disproportionately over the last 15 years. What should we know about this?
So the study came out in the Journal of the American Medical Association, and the data comes from the National Institute of Mental Health. And what was scary about this data is we've been talking a lot about how mental health in children has been worse, particularly worsened after the COVID pandemic, and how suicide rates have been up. But often we think about older teenagers. This data was different. It showed us that the suicide rate has particularly increased amongst children just ages 8 to 12. We're not children we often think about, but may really be struggling out there. Overall, it is boys over girls in terms of having a higher likelihood of suicide, but the biggest increase was actually young girls between the ages of 8 and 12. And so I think we just have to be really thoughtful with our children that we know who may be struggling, making sure that they get the resources and support that they need, particularly at that very vulnerable time when who are often overlooked.
Good advice. Many of us get our medical test results as soon as they're posted, and this is through apps like MyChart, rather from our doctors. Is that really the best when it comes to getting those results?
So a big law was passed back in 2021 called the Cures Act. And that made the data that comes from your lab results, your imaging studies, an MRI, a CAT scan, immediately touched your app or your phone. The law requires that all data is immediately released to patients, and that's what's happened at most health systems, including ours. In many ways, this can be empowering for patients. They can have access to their information. On the other hand, we know of many cases where this can also be scary. Often what happens is something that's not scary, something subtle that says that this is not cancer can be misread, and you can think it's a cancer. Or sometimes it actually is a serious diagnosis, but because you're getting these results, often even before your doctor or your clinician, you're not getting it with the ability to ask questions or get additional information. What I would tell people is this. The law is here to stay. You're going to be getting this data. It's an important opportunity to engage with your clinician. When you see things there, often what we find is to not worry so much immediately, because often these can be benign findings. These could be expected abnormalities. It doesn't mean that there's a tragic illness underneath it all.
All right, and the FDA has approved a blood test to detect colon cancer. What can you tell us about that?
It's a new blood test, just got approved. It's quite good at detecting cancer, and this can hopefully help people who may be wary of getting a colonoscopy or the stool testing done to get colon cancer detected. You do need to be careful, though. This blood test is not very good at detecting precancerous lesions. And those are the polyps that if we can identify them and remove them, you may never get full colon cancer at all. And so talk to your doctor to figure out if this is right for you. If you're not getting tested, or you know somebody who hasn't gotten tested that might be willing to get tested, this could be valuable, but it's important to have some caution.
All right, great advice, Dr. Arjun Venkatesh for Yale Medicine. Thank you for being here with us today.
Thank you.